Joining us to talk more about this report and how it affects Texans is State Representative Donna Howard. She represents part of Austin and is the chair of the Texas House Women's Health Caucus. Thank you so much for being with us today.
Thanks for having me.
Well, first, give us your preliminary thoughts on the report itself.
Actually, it wasn't particularly surprising. We already knew some of this information. We just didn't have the details. In fact, I'm rather concerned that the delay was made to not release this initially, as it was supposed to have been released on September 1, giving us more time to prepare for the legislative session. Bills have already been filed. Over 1,000 bills, I'm sure, have already been filed. And we don't have much time to get ready now for the next session. We'll make it work, but it would have been better to have had more time to discuss the policy recommendations, to determine the best course forward, and to get bills drafted. That's why we needed it when we asked for it September 1. But as I said, it's still alarming. Preventable deaths disproportionately impacting Black moms. We have much work to do.
Well, let's focus on a couple of the findings that are outlined in that report. The first being that, quote, most pregnancy-related deaths were preventable. Now, what exactly does that mean?
Basically, that we are missing something here. We're not catching things when we should be. The leading causes that we're talking about here, obstetric hemorrhage. We have some protocols now that have been put into place that are actually making a difference. We do have updated numbers on that and have seen significant improvements by the use of these best practice protocols that the vast majority of hospitals in the state of Texas are now using and able to intervene and prevent those deaths. Another leading cause is mental health issues. We need to be addressing whatever the mental health conditions are, so that these moms do not get themselves in a position of overdosing on medication to treat those issues. Unfortunately, we also see violence as a result of pregnancy, where these women are dying at the hands of their intimate partner violence with firearms and with strangulation. Obviously, intervening on behalf of those women will be extremely important. Cardiovascular disease that can be treated if it's identified. This really has a lot to do with access to health care and with the medical community being able to respond culturally appropriately and making sure that we are not letting racial biases influence the outcomes of the healthcare delivery.
Now, you mentioned this a little bit earlier. Another finding says that the Black population is disproportionately affected in Texas when it comes to pregnancy-related deaths, and the data shows that the disparity actually grew between 2019 and 2020. So what can be done to fight that kind of disparity?
Well, one of the recommendations they've made, which we actually already have some legislation, thank goodness, starting to prepare for that, has to do with the training of our medical providers to ensure that there is diversity and cultural competency built into that, but also making sure that we're encouraging more people to go into the profession that represent the demographics of our state. There have been studies that clearly show that when you are getting health care from someone who looks like you, represents your community, the outcomes are better. And that could make a difference here. So I have a piece of legislation that is looking at the nursing workforce diversity. Hopefully we will also be able to reinstate the Office of Minority Health that we used to have in place prior to 2017 to help us make sure that we are strategically focused on how racial disparities are impacting outcomes so that we can intervene, make a difference, and save the lives of Texans.
Now, one other finding that we want to focus on is related to COVID-19, and that last finding says the Hispanic population is disproportionately affected when it comes to severe maternal morbidity that coincides with a COVID infection, aka if you're Hispanic, pregnant, and you have COVID-19, you're more likely to die. Are we interpreting that correctly?
Well, there's a lot to look at here, and probably we're going to have to delve into it a bit more. But the bottom line is, when we're looking at the overall pregnancy-related mortality, indeed, as we've already talked about, that disproportionately impacts Black moms at 3 times the rate of white moms. when we're looking at COVID-related morbidities, we know that COVID disproportionately as a whole impacted our Hispanic population to a greater extent. Therefore, extrapolate to pregnancy, and it occurs there as well. Lots to look at why that's the case. Again, having an office that's strategically and specifically focused on looking at these disparities and determining why they are happening so that we can address them is going to be extremely important. And I am very hopeful that we will get that office in place. And we saw during COVID, we did not have that office in place. And we saw, particularly with our Hispanic population, that they were not getting the testing and the vaccines in a timely fashion. We could have done more to intervene, perhaps, if there had been someone at the table that was specifically looking at that particular issue.
And finally, let's talk about the delay in actually getting all of this data. What does that mean for lawmakers like yourself who have to use it to help craft legislation going into the session next month?
I would say it puts us, a couple of months for sure, a couple of months behind where we should be right now. We've already been working the past several months on drafting legislation for this upcoming session. We certainly have a couple of more months to get legislation filed, but it takes a long time to actually draft the legislation. First, you have to talk with all the stakeholders to make sure you are coming up with a policy that is going to actually address what you want to address. That takes a while to do. We're coming up on the holidays. People are not going to be around to have those conversations. But then we have to get the legislation drafted by legislative council. They're already backed up with what's been in the queue now for the past couple of months. So as I said, I'm hopeful we're going to get this done. We will do everything we can to push it through, but we are way behind the time frame here that we needed to have this information in order to make the policy changes that we hope will make a difference. We are still going to work on it. We're still already doing things about extending postpartum Medicaid coverage, about trying to get more access to health care, about trying to incorporate mental health care within the whole system. There are things that we already knew generally, but to have the specific information that will allow us to craft policies that directly address these recommendations, we're behind, but we will continue to work on it and make sure we get as much done this session as possible.
And time is of the essence. A lot to get done during this next legislative session. And State Representative Donna Howard, thank you so much for being with us today. We appreciate it.
Thank you. Appreciate it.